Professor Lawrence Goodridge, thank you very much for taking the time.
Good afternoon.
So you're with the University of Guelph, and you're part of the wastewater group that's looking at what we're finding in the water. And what have you found?
What we found is that wastewater is a very reliable indicator of the amount of people who are infected with COVID-19, and we can use that to determine or gain a rough estimate, at least of the people in a geographical region that have COVID-19.
Now, what have you noticed since the new Omicron variant has arrived?
So prior to Omicron, we were seeing a decrease in the wastewater signal. So from the summer of 2021, the late summer of 2021 through the fall, we saw a general decrease in the signal. And then in late November to early December, when the Omicron variant was identified, we started to see an increase in signal. That signal increased through December, and the signal has remained high with our current testing data.
In some municipalities, we were talking to the University of Ryerson, and they said that they've noticed that it's peaked a little. Have you at all noticed any peak in how much COVID you're finding in wastewater?
Generally, I would agree that it appears that the wastewater signal has flattened, but I think we need more data before we can say that definitively.
Now, based on what you've seen in the past, I mean, the pandemic has gone on for so long. Based on what you've seen in the past, what's the correlation between what you see and how it plays out in clinical data? And are your readings basically foreshadowing what we see in terms of cases?
We're seeing that wastewater is a great indicator of that. That is, as the wastewater signal increases, that is followed by an increase in hospitalizations in the same geographic region.
How much of a difference does this make right now, considering that testing isn't happening as much as it was happening, say, 3-4 weeks ago?
So I think this is where wastewater surveillance is really shining. I've always said that wastewater surveillance is another tool in our toolbox. That is, it should not be looked at as being a replacement for clinical testing. It can add additional information. However, now that clinical testing has really been severely reduced, wastewater surveillance is basically the only tool we have to estimate the infections in the communities. So I think, in my opinion, wastewater-based surveillance has never been more important, and it will be increasingly important as we move forward. And I think because of this, we're seeing a number of public health units across Ontario really begin to rely on wastewater surveillance to gain an understanding of what's going on in their respective communities.